Now, as I said, the patient is instructed about the importance of controlling the environment and at the workplace. For example, we just talked the other time about adjusting the windows, clean the fans, obviously fan, clean it, the cobweb, all those things. Then aerosol sprays may be helpful in suiting mucous membrane, softening prostate secretion and removing irritant. Like I said, this spray, okay, that you can put in the mouth, you spray it in the mouth and then you close your mouth. They diffuse through the pharynx to the upper respiratory tract then and soften those hard, those mucus, soften it, then you can now blow it out. So those ones you can.
Is it like inhaler?
Yes, almost like inhaler. But in the case of inhaler, you put it in your mouth, close your mouth before you puff it. This one you don't need to put your mouth on it, just open your mouth. Yes, spray it, and then you close your mouth. For a certain period of time, they will have put the instruction on the container. Maybe like 5 minutes, you close your mouth so as to diffuse round and then soften the thick mucus and then you can breathe properly. Okay. Then, stay on the role of carer. The carer instructs the patient in the proper use and technique of administering nasal medication. Like if you are giving Otrivin, for example, Otrivin is a nasal medication that you drop just as you have your nasal eye drop. The same thing too, you have nasal drop. Yes, particularly in a severe nasal blockage whereby you cannot breathe at all. Just drop it. So it is your role to teach that person how to apply it. When you apply it, don't let it touch your nose. Because if you touch your nose, you have contaminated the tip of the whole thing. So you just like saying your eye drop too. Yes. So you drop it there. As you drop it, it remains there. So that's nasal spray goes in and then soften the mucus and then you just go and blow it out. That is it. Then to achieve maximum relief, the patient is instructed to blow the nose before applying any medication into the nasal cavity. In the case of infectious rhinitis, the carer reviews with the patient hand hygiene technique as a measure to prevent transmission of organisms. Then the carer teaches method of steam inhalation. So these are your role as a carer in the prevention of rhinitis. And what we mean is that apart from teaching the patient the proper administration of nasal cavity, before they apply the nasal drop, tell them to blow their nose first before applying it. Then thereafter, before it can be effective. And then you also review the patient hand hygiene. Say the tie that has good hand hygiene, or is the tie that the handkerchief is using to blow the nose, still put it in the pockets. And then when there is sweat, still bring out that handkerchief and clean the face. That is not allowed. So you let them know. Each time you blow your nose, try wash your hand. Use tissue instead of hanky. Tissue disposable, blow it, dispose it off properly. That is how you. That is how you educate them or you instruct them on what to do. Then you teach them. The carer teaches them method of stimulation. Stimulation, just like you mentioned the other time, is a way of relieving the respiratory tract infection. Of course, the rationale behind it is that bacteria cannot withstand heat. Okay, they cannot withstand heat, and any upper respiratory tract infection that involve bacteria, you need to put steam inhalation apart from other things you are putting, even you are using as a nasal drop or tablet or whatever. And how to do steam inhalation is that you boil water, hot water, then you get eucalyptus oil, what is called silver bed. Yes, silver bed, that is the English name. The silver bed, just a drop, not much, just put a drop in that hot water. You pour it in a bowl, drop the silver bed, then you cover your face with blanket on it. So as the steam is coming up, you'll be inhaling it. If it is small children you are doing it for, just try and be friendly. Okay? As you are there, you will try to remove because you cover your face, so both of you are doing it together. So just be playing with each other. Count for me. Can you count 1 to 10? Let me see. Count, I'll give you chocolate. As it's because of chocolate, you want to count. In the process of counting, it's inhaling. It's inhaling. By the time you count to that, it's up to 10. Now remove the clothes. Okay, I'll remove it. Can you count one more again for me? Then you now remove. Then you cover again like that. By the time you do it 2-3 days, you see everything will clear off. That is the method of steam inhalation. Yes, if you don't have the inhalator, you can use Aboniki can be used, but you not for the children, not for children. But you as an adult, your membrane is keratinized and withstand all those kind. And even as an adult, don't use it on your nose, because that one doesn't know whether baby or adult. But you can put it in hot water and inhale it as an adult, but not for the children. That silver bed is very mild, and that's why it's always good for the baby, particularly infants, not for even this thing. It's for the infant. Okay, so that is it. Then the second condition that can affect the respiratory system is sinusitis. Sinusitis. Okay, this is the inflammation of the sinus, right? Some individuals are more prone to sinusitis because of their occupation. For example, continuous exposure to environmental hazards such as paint, sawdust, and chemicals may result in chronic inflammation of the nasal passageways. Now, the sinusitis, as we said, it is the inflammation of all those nasal sinuses we mentioned the other time. So whenever they are inflamed, and it's another common condition that affects people, particularly those that work in those companies we mentioned, like chemical industry, where they produce paint. Even if they just paint this house newly, okay, and you come in, you notice that you will be comfortable. And now to talk of somebody that is there 24/7 working there, and that is why the rules, if you check their regulation, working condition, they are supposed to be taken care of, and they should be allowed to go to their leave when time due, because they are really taking a lot of risk. Apart from the fact that they put on nose masks, okay, but no matter how nose mask, they still inhale some portions of chemicals before they close. So those people, and then people that work in the plant industry, sawdust also predispose them to all this sinusitis. Now, what are the clinical manifestations? It includes facial pain or pressure over the affected sinus areas, nasal obstruction, fatigue, prolonged nasal discharge, fever, headache, ear pain, and fullness. Then dental pain, cough, decreased sense of smell, sore throat, eyelid edema, or facial congestion or fullness. Sinusitis can be difficult to differentiate from an upper respiratory tract infection or allergic rhinitis. Now, the signs and symptoms is what I've just listed there. We said the first one is that there will be pain on the affected area. If you palpate it, the patient complains of pain, okay? And then if you try to look down, say you should look down, you look as if the whole eyeball want to pull out, okay? Those are the signs of it. Then there is nasal obstruction. Because of the inflammation there, the distance is not far from the nose, so it will affect the goblet cells. They will be discharging, so that discharge will block the nostrils, so that brings about nasal obstruction. Then there is fatigue, tiredness, because once oxygen cannot go into the body cells, there's nothing cells will use for you to perform, so you become weak because there's not enough oxygen in the bloodstream. Then there could be nasal discharge, which can be purulent. Purulent in the sense that if you bring it out, you see it's colorized, okay, it will be brown or yellowish in color. So that is what they mean by purulent nasal discharge. Then there is headache. Also there is fever. Fever comes in because of the presence of the bacteria causing this thing in the bloodstream. It will tamper, because you know that blood is flowing to the brain too. The thermostat in the brain that helps to regulate the body temperature, which is in the hypothalamus. This organism will tamper with the thermostat and make it not to be working, and then the temperature goes up. That's what brings about the fever. And then the headache is as a result of nerve ending. Pressure on the nerve ending brings about the headache. Then ear pain will be there too, because there is connection between the nose and the ear through the canal known as eustachian tube. Okay, this eustachian tube is the joint between the nose and the ear, and that is why when you close your nostrils, you try to blow forcefully, you notice that you have a kind of partial blockage in your ear because of that connection. So once there is inflammation around here, it can easily travel, the bacteria can easily travel to the middle ear and the inner ear and cause pain here that you notice at the end of the day. Then there could be cough as well, because as this thing going around, it travels to the trachea, and then the cough center try to be stimulated so as to remove it out. So those are the signs and symptoms, and they will say there is decreased sense of smell, because your olfactory bulb that's supposed to pick the chemical, either the gas or the chemical component or whatever is in the environment, cannot go in because of that blockage. So you won't perceive something may be burning, you won't perceive it that something is burning. So those are the signs and symptoms of the sinusitis. Now, your role as a carer, role of a carer in the treatment of sinusitis. Patient teaching is an important aspect of caring for patients with acute sinusitis. The carer instructs the patient about methods to promote drainage, such as inhaling steam, okay, inhaling steam, increasing fluid intake, and applying local heat, okay, that is hot wet bath. The carer stress the importance of following the recommended antibiotic regimen, because a consistent blood level of the medication is critical to treat the infection. What we mean here is that your role as a carer is that you must educate this person, because if you do not educate her properly, if you just give her drug or just recommend drug, you will not really know the rationale behind what you ask her or what you ask him to do. So that's why we say that patient teaching is an important aspect in the caring for these clients that have this kind of condition. So you instruct them about a method to promote drainage. Okay, for that drainage to come is that they should do steam inhalation. They should try to inhale. By the time they inhale steam, the steam will render the bacteria inactive, and then thereby soften the mucus therein, and then it will blow out of the nose. Also, you tell them to increase fluid intake, because as you cannot breathe through your nose, you are breathing through the mouth, you are losing water. That's what is called insensible water loss. As I'm talking now, water is being lost out of my body. As you sit down, you are sweating, you are losing water. So all these things, we call them insensible water loss. So you tell them the importance of taking water. And taking water, not cold water, warm water. Okay, you can take warm water, yes, or ordinary water in the room temperature if they don't have access to warm water. So all this thing is to help to soften the mucus so that it can get rid of it. Then also application of local heat. Okay, they get hot. They can put towel if they don't have hot water bottle. They can put towel in hot water, squeeze it, place it on that site. Okay, that's what we mean by application of heat. Okay, then you tell them the importance of following the drug regimen. Some of them, when you take antibiotic, for example, it's okay, take the ciprofloxacin 500 milligram QDS for 7 days or 10 days. The moment they take it for 2 days and the symptom relief, they say, I'm okay, stop.
You use that medical term.
Yes.
7 days.
Yes.
PD.
Yes. They will now say, I'm okay now. What is the essence of taking this abeg? Not. And by the time this infection will come back again, it will come back very strong. So at that point, ciprofloxacin is just like a mild antibiotic. This point is now you will need to be looking at augmentin to be able to combat the same infection that we are using ordinary ciprotab, for example. So that is why you need to tell them that this drug I'm giving you, you are going to take it for 7 days or 10 days, depends. And you must make sure you take it finish. If you do not take it, if you stop halfway and this thing, you are starting all over. Yeah, we are not starting with this type of drug. Maybe the ciprotab is just 3,000 naira. The chemist man selling it. Augmentin will be telling you 10,000 per sachet. Yes. Let me do something very expensive now. That is why take care of your health. Take care of your health. So you tell them. So by the time you tell them all this reason, they will know that they need to be very serious in this thing. Okay? So that is it. Then the laryngitis is the third symptom that we look at. Laryngitis, that's inflammation of the larynx, okay, which I call the voice box the other time. So laryngitis and inflammation of the larynx often occur as a result of voice abuse or exposure to dust, chemical smoke, and other pollutants, or as part of upper respiratory tract infection. It may also be caused by isolated infection involving only the vocal cord. Those are the things that can cause the laryngitis. That is, as a result of voice abuse is a common thing in this part of our society. Because I don't know why. I can remember in those days when we were small, when my mother wanted to say we should pray. Now gather us. You know, as a young man, then say, oh, land, oh, pariwo. I say, why must we pariwo? Is God deaf? And you know, they will look at me as a satanic child. Oh, land, oh, pariwo. I say, why Oluwa? Is God deaf? And you know, they will be looking at you and say, it's like this boy, you want to belong to the other camp. But actually, we don't need all those things. God can hear us. This thing we pray. But today you must scream, and you know, all those things is not really this thing. I'm not against your religion, no, because me, I always tell my people that even though if you bite me and say that if I not shout, I know you can't force me, say you must shout today. So shout, and then those that can shout, let them shout. It's not by force that I must shout, but I know that God is not there that He cannot hear us. Okay, so voice abuse is one of the common things that causes this laryngitis or exposure to cold or infection. Like some of the upper respiratory tract infection, when they come, they can easily affect the larynx, thereby causing laryngitis. Now, signs and symptoms of it. Yes.
Can stress also cause infection of stress?
No.
Because
if it not involve the voice cord, if the voice cord is not there, the only thing that just bring general fatigue and then lower the immunity. That's another thing. Stress can lower immunity that will bring in upper respiratory tract infection. But cannot affect.
Because somebody told me that whenever she's stressed, she just discovered that she can't talk very well.
Maybe sinusitis you have, but once you have a sinusitis, talking becomes difficult. You know, somebody's asking, say, what is your name? No, he's talking, but you are not hearing properly because those sinus are blocked with the bacterial causes. But stress, I don't call laryngitis. Laryngitis has to do with the mistake. And that's one that occurred that when after you're shouting, you come to the heart. Because you have abused. Now it is not the sinus. We can hear that you are calling Modupe, but you yourself, it is by strength you are using to call him. We can hear you that it is Modupe you are calling, but you are not comfortable. Okay? But the person hearing you can hear that, okay, it's Modupe you are calling. So that one, stress cannot cause it. It is either voice abuse or infection. And the upper respiratory tract infection can also make you not to talk properly, like the sinus once they are inflamed. And stress can bring about that because stress, one of the cardinal signs of stress is to kill immunity. And once immunity is killed, opportunistic infection comes in. And part of it is those staphylococcus that can really affect this thing. So signs of acute laryngitis include hoarseness or aphonia. Aphonia means complete loss of voice and severe cough. You see them, not to talk. Hey, the vocal cord is not free. It's not free. So as you want to force it to speak, cough center will detect it, and then you begin to cough. You begin to cough. So chronic laryngitis is marked by persistent hoarseness. Hoarseness is that those ones there is no amount of, except you place them on strong antibiotic. Constantly they are talking, you cannot hear what they are saying. They speak with difficulties. That's chronic laryngitis. But the acute one can lead to aphonia. That's loss of listening. The person is talking, he's opening his mouth, you are not hearing properly. That's what we call aphonia. Okay? The laryngitis may be complication of upper respiratory tract infection. That is, upper respiratory tract infection that's not properly treated can affect the vocal cord. Okay, those are the complication of it. The carer instructs the patient to rest the voice and to maintain a well humidified. That's the role of carers now. You tell the patient to rest the voice and to maintain a well humidified environment. If laryngeal secretion are present during acute episode, expectorant agents are suggested along with daily fluid intake of 3 liters to tame the secretion. Like now, if an individual, as he's trying to speak or talk, is coughing along and then trying to bring or having a dry cough, you prescribe expectorant for them to take. The expectorant is to soften the mucus and then bring it out. Then you tell them to increase fluid intake. Fluid intake is very, very important. You should take it at least daily intake of 3 liters so as to tame the secretion inside. Now, what are the terminologies associated with respiratory tract, respiratory system? Number one, we have what we call anoxia. Anoxia is A-N-O-X-I-A. Anoxia means a condition of low oxygen tension. Okay, low oxygen tension. Then you have asthma. Asthma is also a term. It's an acute respiratory disorder that is characterized by unusually sensitive irritable conducting passageways, whereby the respiratory tract unnecessarily become sensitive to the point that it will vasoconstrict, be constricted to the point that to breathe become difficult. And you see them begin to gasp for air, coughing, gasping for air until you bring in the inhaler to help them. Then you have what you call atelectasis. Atelectasis as in A-T-E-L-E-C-T-A-S-I-S. It's collapsed lung. When the lung collapse is what we call atelectasis. Then bronchitis, inflammation of the bronchi. We have what we call epistasis. Epistasis is the bleeding nose. Okay, bleeding nose is what we call epistasis. Then you have what we call hypercapnia. Hypercapnia, excess carbon dioxide in the bloodstream. Then you have hypocapnia, which is a low carbon dioxide in the bloodstream. So there are a lot of terminologies there. When you get the slide, get yourself familiar to it. So you just take 5 minutes break, then we come back to the next. You say, okay, any questions? You can take your break so that because we are starting straight away. Sir? Some stammering. No. Stuttering or stammering.
Is it not the same thing now? Stuttering and
okay, you're trying to snoring. I'm trying to snoring. No. Stammering. Stammering has to do with the muscles of speech. Okay? And then connection with the Broca's area in the brain. That's the speech area in the brain.
And sometimes it's genetic.
Yes, of course, genetic. Most of the time, it's genetic. Most of the time, it's genetic. So that is it. It has nothing to do with respiratory tract.
so bleeding nose, is it an infection?
No, it's not an infection. Most of the time, it could be a sign of underlying problem. For example, now, severe hypertension can come down with bleeding nose. Apart from trauma,
What about in a child?
hit you.
In a child?
In a child. Yes, in a child, bleeding nose. It could be as a result of what do you call this thing? Dryness, maybe excessive cold. This child is exposed to excessive cold, and cold has a way, it has vasoconstricting effects. It has vasoconstricting effect. It vasoconstricts blood vessels. So when this child is exposed to air, like maybe fan or AC, and all these things are dry air. So as they go in there, they vasoconstrict the bronchioles, the arterioles, okay, the arteries in the nose. And then because of that vasodilate, now tear, and then begin to bleed.
So, how can we prevent it?
Yes, the thing is that one, in that case, you first of all apply cold compress. Then you use pad to pack the You want to block it to clean the this thing. Then you apply cold compress on the ridges of the bone because at that thing here, it is still cold that she needs to close it up. Yes, to close it back. Then thereafter, you can now give drugs. Okay, you give this thing, anticoagulant. Okay, you give anticoagulant. Okay, to help to arrest the bleeding. That's clotting. Okay, to arrest the clotting, to bring about clotting. Then the child, you instruct him or her not to blow. Okay, the more it blows, the more something will cut. Okay, the more it blows, the more something will cut. Okay. Then intermittently you tilt the head backward, but not directly like this, just tilt it backward small. Then you tell him or her, you can take instruction that if something is dropping in the mouth, you should do this. But if you cannot talk, then you don't need to tilt the head backward, just using cold this thing. So massage this thing.
Like my son's phone, like sleeping in the night.
On the nose. Maybe check the AC temperature is much. With the AC temperature, it might have been accommodating it, and the more something is like it has gotten to the last point, to the last degree, is something just severe. Then so watch out for the temperature around the house. That's one of the things that can easily cause it among the children. But in the case of adults, it's hypertension or trauma. That is it. That is it.
Okay.
So please, 5 minutes break, and then we come back. Yes, by quarter past, this is 10 minutes after 11. By quarter, this thing, we start the next this thing, because by next week, I'll be around. So that, thank you. Thank you.
Mrs. Owo, how are you? Morning, woman. Money, woman.
Just ask of you.
I'm not dropping clinical documentation.
I will have to check. I can't say because I'm very consistent. Yeah, you said you have to.
I don't. I'll send it. I'll drop it.